So you experienced LASIK. You had the gift of refractive surgery per se. Refractive surgery, there's a very different level of pressure relative to normal ophthalmic surgery. I mean, any ophthalmic surgery is high stakes. Like we talked about, you have patients' vision in their hands. But refractive surgery, you're often, unless you're really looking at eyes that have high refractive errors, being eyes with pathology, a lot of times you're taking eyes that can see 20/20 or even better with glasses or contacts, and you're performing surgery on them to not prevent loss of function, to achieve gain of function. So you're taking healthy eyes and doing surgery on them. And there's a lot of people who would say, a lot of people who aren't into refractive surgery would say, why would you ever do that? That's crazy. And you see the impact you can have on the quality of life of these patients. What was that like, transitioning from comprehensive ophthalmology to refractive surgery? It's a very different pressure.
Yeah, it is a different pressure, but I think what you have to start taking into perspective is, you mentioned the word normal eyes, and the question is, what is normal eyes? And again, I think to a lot of our colleagues who are non-refractive surgeons, they would say that these are all normal eyes. But the reality is, from my perspective, is that you're depending upon some other ancillary thing, like whether it be glasses, contact lenses, something to go ahead and try to get you so that you can have this good vision. So I don't view it as cosmetic surgery, because in cosmetic surgery, you're changing the appearance of how something looks. Whereas in refractive surgery, you're changing how well the eye functions. I mean, you're actually improving the functionality of the eye itself. So I think when you look at it from that perspective, I mean, it is not really working on a normal eye, but it's taking an eye that has some level of dysfunction that you're trying to improve the functionality of. That being said, you are absolutely correct that the stakes are much higher, in the sense that I'm taking someone that may have relatively good vision, and everyone's got a different threshold as far as what they feel comfortable with. I mean, I'm now at a point in time where someone may have a minus a half diopter sphere, and I feel very comfortable that depending upon the metrics and how they feel, I could go ahead and, in fact, that's sort of where my wife was at. I did LASIK on her eyes, and she loves the fact that her vision is. So a lot of times it's all relative, in the sense that you only know what you see. You don't know what you potentially could get to. And if you can get to that point, and the beauty of refractive surgery is that we're now at a stage where we can potentially deliver vision that may potentially be better than what their patient was used to, even with their glasses or contact lenses. I know presbyopia is still a big area that we're still working towards inside there. But as far as myopia, hyperopia, things like that, I mean, technology is great right now, and it's just continuing to evolve and keep on improving and getting better.